Another issue I want to raise is domestic and family violence roundtable that I hosted recently. Earlier this month, I held this roundtable with many of our leading organisations and not-for-profits in Warringah. We heard from those on the front line of our community, such as Northern Beaches Women's Shelter, Mary's House, Women and Children's First, Women's Resilience Centre and Dalwood Splistead, LocalKind and St Vincent's de Paul and Lighthouse for the community. These providers play an immense role providing shelters, crisis accommodation and also practical support such as funding for car registration, laptops, food bank and clothing, and connecting affected families with legal and immigration services. We heard from those working in the mental health space, such as Mentoring Men and Lifeline Northern Beaches, and these organisations help to shift attitudes, rebuild confidence and address the trauma before it becomes another statistic. Importantly, we heard from the local primary health network who work with preventative and crisis centres to make sure that women and children escaping domestic and family violence get the mental health and wellbeing support that they require. We also heard from local residents and advocates, both men and women, who shared their ideas and lived experience. The roundtable highlighted what we already know. Our crisis centres are in crisis, and our mental and primary health services are under incredible strain. Northern Beaches Women's Shelter accepted 12 women per day in 2020. The demand is now up to 70 per day. Last year, they were able to house 273 women and children, but had to turn away some 584 women. These are women who are attending the service, but we know that there are so many more that even don't report or don't come to services, and they don't receive support for fear of retribution. Now, these services are relied upon by the community. As pointed out by the Women's Resilience Centre, many women can feel uncomfortable going to police. We know 78% of women never report violence to the police. And too often, funding is tied to reporting. And so the problem, there is a question around the way funding is allocated from New South Wales and the staying home, leaving violence, because it's often tied to whether or not reports have been made. With increased demand, grant funding is simply not sufficient. This is an issue where it's not just a question of more money has been spent by the government, and so why is the problem not getting better? The problem is we're still underfunding this sector. There are 5 key outcomes that came out of this roundtable. First, crisis centres are overwhelmingly providing funding assistance for women who are escaping domestic and family violence that may be tied to their partner, meaning that they're unable to access job seeker and family benefit payments. So this is a question where they're here on partner visas, and as a result, the non-profit organisations are having to meet and support these women in a way that we should normally be able to get them into our systems. So I've raised with the Minister's Office that we should have in circumstances of domestic and family violence with partner visas, we need to be able to move these women onto visas that enable them to access supports, so our non-for-profit organisations are not carrying the financial burden. And I look forward to trying to find a solution to this problem. 2, greater support for children who are escaping violence. Crisis centres need the right scaffolding to support children. Their needs are different to that of their parents. This includes appropriate housing and other practical support, clothes, books, school supplies. We know, for example, that 10 sessions for GP mental health is proving to be insufficient to effectively respond to the situation, in particular for children impacted by the situation. Thirdly, at the heart of the crisis is housing. Greater funding for crisis housing and looking at different opportunities to redevelop existing infrastructure, such as aged care facilities. There is a lack of real data on DV numbers and available housing. New South Wales, I was shocked to find out, has no centralised domestic violence housing vacancy management system. It is up to each individual organisation to go and source and find out whether or not there is housing. This is a simple fix to have a database to ensure that happens. We know it creates extra administration burden on crisis centres that are already understaffed and struggling. They have to spend time calling around, connecting with other centres for availability for women who need shelter. Surely we can have a centralised domestic violence housing vacancy management system. Better discretion for organisations to distribute funding as they see fit was also called for, especially with accommodation to meet high rental costs in Sydney. Currently, the way funding is allocated to these organisations, it has got so much regulation and rules around it, they can't apply it in a discretionary way to short-term accommodation to make up for shortfalls of crisis accommodation being available. So that was an overwhelming call as well. The fourth point was the implementation of specialist domestic and family violence courts that have the expertise of dealing with victims of domestic family violence. We have specialist courts for other areas. Why do we not have a specialised court for domestic and family violence? Having come as a barrister from the family law sector, there is no doubt that domestic and family violence is prevalent across many areas. We should have a specialised stream in our courts to deal with this issue so that we have specialist decision makers and the proper training and understanding. The fifth area, most importantly, is that obviously prevention needs to be addressed if we are going to have any hope of achieving the goal of eliminating domestic and family violence and at least reducing it substantially. We need the urgent implementation of the rapid review recommendation, especially around delay or reduction of alcohol delivery times that had been increased during COVID. That's already been implemented by the ACT. We need to reduce gambling advertising. We need to ban gambling advertising. The link between gambling, alcohol is really clear about increased numbers of domestic violence. So I urge the government to implement recommendations of the Murphy Review and to start acting on these known social harms. We need men to be part of the conversation, especially those who are calling for change. An organisation that I've met with, Mentoring Men, are desperate for funding. They can't get any funding, and yet this is an organisation that has grown out of mental health support but is now playing a role in domestic violence. They can have the peer-to-peer, the man-to-man conversation to start calling out this scourge. So much more to be done.